Thank you very much for that, Dave. Let me pull this over here. Okay, get this window open here. Okay, good morning, everyone. I'm Mary Jones. I serve as chair of the Marriage and Family Therapy Advisory Committee for the Kansas Behavioral Science Regulatory Board. Today is August 15th, 2025. I ask the members of the advisory committee to respond to a roll call signifying their presence at this open meeting that's being conducted remotely by conference call or electronic medium. Nicole Eitzen.
Here.
Chris Hebben.
Here.
Diane Siebel.
Here.
And Heidi Vella.
Here.
I note the following BSRB staff members are also present. David Fye.
Here.
Great. And David will now read a message about this meeting being conducted remotely.
All right. Thank you, Mary. This is David Fye, Executive Director for the Kansas Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about any concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. No time has been reserved for public comment, as no individuals requested time for public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On June 23rd, 2025, we sent notice of the advisory committee meeting to all individuals who had requested notice of such meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call line is active. I did check it before we got started. There's no one on the line, but if I hear someone beep over and introduce themselves, I will let you know.
Okay, great. Thank you, David. The next item of business is reviewing the agenda to see if we're in agreement or if there's any modifications to the agenda items. I'll take those now. If not, I'll take a motion to approve.
I motion to approve.
Thank you, Nicole. Is there a second?
Second.
Thanks, Chris. All those in favor, please say aye.
Aye.
Aye. Any opposed, same sign. Wonderful, thank you. Next item of business would be review and approval of the advisory committee minutes on April 11th and June 13th. We did not have quorum at the last meeting, so we weren't able to approve the meeting. So if you've had a chance to review them, I'll take a motion, and if not, we'll give it just a minute to see if there's any comments or edits that need to be made.
I motion to approve.
Thank you, Heidi. Is there a second?
Second.
Was that Diane?
Yes.
Okay, thank you. All those in favor, please say aye.
Aye.
Aye. Any opposed, same sign. Great, thank you. Okay, Dave, I'm going to hand it over to you for the executive director's report.
All right. Thank you, Mary. And we'll start with a few BSRB operations updates. First, I do want to highlight some positive recognition that we received recently on our new website. Last year, we began the process of transitioning over from our previous website hosted by Sitefinity to a new website hosted by Granicus. And as you have seen the changes to the website, you see that the front page specifically looks quite a bit different. Part of that was done with the intention of making it a bit more user-friendly and having a little bit more ease of access to get to some of the main functionality for the website. Some of it also, too, was to make it a little bit more cleaner, so we would still have the content, but there wouldn't be quite so much text. And then the third was to make it a little bit more user-friendly for individuals using mobile devices. Over time, people have transitioned between really accessing a lot of information on a traditional desktop computer or even a laptop to using their phones. And so we were trying to progress with that as well and help people access the information using their devices. And so we were praised by an organization called the Association of State and Provincial Psychology Boards. They had an article where they were highlighting 10 different states and jurisdictions and some of the user-friendly nature of their website. And so there were a couple of different categories in which they praised the BSRB website. So we were happy to receive the compliments, and I highlighted that article on news article on our website. So feel free to take a look at that, and happy that they were looking at the website and that they got some ease of access from it. And so we are always listening for feedback, and it was nice to receive some positive feedback. So I wanted to highlight that for you. Concerning another operations update, at the last meeting, we talked a little bit about CE Broker. That is an organization that the board had agreed to partner with last year. What CE Broker does is it's a company that provides free services to licensing boards to allow their licensees a portal to upload documentation of continuing education hours, so that when you are going to renew your license and you are attesting that you've completed all of your hours, if you're selected for audit, the board would need to review your materials to make sure that you had completed all of your hours. What CE Broker offers is a portal where you can upload those documents. So if you are selected for audit, we can just log into the portal, verify you have your hours and you have them in the right categories, and then the audit can be approved much quicker. And so since about January is when all 7 professions were live within the CE Broker portal. We rolled out the implementation in 3 different phases, but as of January, all of them have been live. And so we wanted to collect a little bit of feedback from CE Broker to hear how the uptake has gone in terms of our licensees using CE Broker. And in our last meeting, we did ask some of you what your thoughts were if you had used CE Broker, if you had heard any kind of feedback. And so we wanted to deliver that to their representatives as well. So we had a meeting with them. What we have learned is that, I'll frame one more thing too. So the reason how a company like CE Broker can provide this as a free service to licensing boards and licensees is because they also have an optional service of paid membership with some additional resources. They can help connect people to specific CEs, and there's some other resources. But one thing that we were very intentional about in the board's agreement with CE Broker was that no one had to use CE Broker if they didn't want to. So it was an opt-in type of a service. But there was the option, if people wanted to not just use the free account, they could also choose to use a paid account if they wanted to do so. So in terms of how many people are currently using CE Broker under the BSRB, we received information that there's about 1,757 individuals between the free accounts and the paid accounts. So it's an uptake of about 11% so far. And what they are seeing is that most people that choose to use CE Broker are doing it right before their renewal. And so since we did go live in January, I think probably over the next couple of years, that'll be a way for us to measure how many people are using CE Broker services. When people come up to their renewal, they'll make a choice about, do you want to use CE Broker to upload your documents, or do you want to renew? And then if you're audited, you'll do it the traditional way. So about 11% uptake right now between the free and the paid services. We also asked them how many service tickets they had received with people that having issues with CE Broker services. They said since January, they had received 26 total tickets with issues. 19 of those were from individual licensees using the portal to upload documentation, and then about 7 from non-licensees. And that generally refers to our social work CE providers. There's a method with which they can become pre-approved providers. And so we were able to put that into the portal as well with CE Broker. So there were a few tickets for the pre-approved providers for social work education, but between the professions and the licensees submitting tickets, there were about 19 since January, which for about 1,800 people that signed up for it, I feel like that's a pretty good ratio. But we do want to make sure that people have a user-friendly experience. We want to make sure that process is easier for people. So one other category of feedback we received last time was when we had the initial launch, we sent out information, we posted information on the website, but do people still have an easy way to access the CE broker information? And so one thing that was requested last time was to add more links to CE broker information on our website. So we decided to do that. On the professions page, there's a section that talks about the renewal process, and we added a new link for all 7 professions. So there is a link right there under the renewal information about CE broker and some of the benefits, and how to activate an account there too. So we went ahead and made that change, and we also are adding some language to our expiration of license letters. So those get sent out 90 days and 60 days and 30 days in advance of when your license is going to expire. So we're going to add some language in there. We're working on a paragraph to add that will highlight CE broker as an option. And then if people want to use that at that point, they can do that as well. So we are also working towards another step with using CE broker, and this will probably happen sometime in about the next year or so, as we're making the transition from our current licensing vendor to the new licensing vendor with the state's enterprise licensing system with Acela. We would like there to be a live link between our license information and CE broker. The goal would be that if someone is going to renew their license electronically and they're going through the steps, they would get to the part that talks about continuing education, and at that point they would have a button that they could click to check. And if they are using CE broker services, it would do a live look into CE broker to see, has this person uploaded all of their documentation of continuing education? Have they assigned it in the right categories? Because we would like people who are using CE broker to have a little bit of verification that as far as they can tell, everything looks good, and then they can move forward. We're not going to stop anybody from moving forward. If they're not using CE broker, they would still be able to advance, but it would be a confirmation that people could check then at the time that they're doing their renewal. So we have tried to build that as an API into our current vendor. It looks like that's probably not going to happen until the new system is in place, but that's something that is a long-term goal for at least about a year out, probably. Concerning other items, we did just wrap up all of our surveys. So we've been talking a little bit about the survey specifically for marriage and family therapy licensees, but we did do surveys of all 7 professions, and we also asked a little bit different questions based on the licensure level for the different professions. So this was quite an undertaking. It involved basically close to about 13 different surveys that were being sent out, and we collected all that information, and we have draft reports for all the professions now. Social work was the one that just wrapped up, and we had 2,000 social workers respond to that survey. So that was very successful. The next step is really continuing to go through the information like we're doing with the advisory committee. And then also we mentioned we were doing a comparison report between the 7 professions. So that is something we're working on wrapping up as well. Moving next to some legislative updates, I wanted to make you aware of 2 different meetings. First, there was a committee meeting by a House Legislative Committee called the House Select Committee on Government Oversight. And that was a meeting that took place on July 29th. The primary focus for that meeting was on the operations of the Board of Nursing. They were reviewing some of their processes, specifically as it relates to license renewal, license reinstatement. They were also looking a little bit into some of their disciplinary processes. And in the afternoon, this was all public, but they had 2 people who had had a disciplinary violation because these are 2 people who were nurses. They had active licenses. Through different events, their licenses expired. And then there was a question of, had they continued to practice? They each had received a disciplinary violation, a consent agreement order signed with the board, and they had encountered difficulties being hired after receiving the disciplinary violation. And so the committee was asking questions along the lines of, is it unprofessional conduct if someone's license expires? How does the board go through some of these processes? Is it clearly defined? Do you give people enough notice before someone's license expired? Do you give them adequate notice their license has expired? And so while the focus was on the Board of Nursing as a regulatory board, of course, we want to be mindful of the focus the legislature is putting and these questions that they're asking. And so we did observe that meeting, and we actually were asked for some information in advance of that meeting that was handed out. They had asked us basically some of our processes relating to renewal, reinstatement, and that was a handout put together by the Kansas Department for Legislative Research. And so it had our responses along with those of the Board of Healing Arts, the Board of Pharmacy, and the Dental Board. I think it was meant to compare the Board of Nursing's practice to some of the other health regulatory boards. And so I can tell you, we did receive a compliment by one of the individuals at the meeting. She was licensed as a nurse, but she was also licensed as an addiction counselor under us. And while she was very upset that the Board of Nursing, in her opinion, had not provided her with enough notice about the expiration of her license, she was also complimentary of the BSRB because she highlighted to the committee that we send out 3 different emails to let someone know that their license is going to expire before it does. And so we can always look for improvements, though. You know, it sounded like what the Board of Nursing was doing was sending out a postcard and then sending out an email if someone had opted into a service. For us, as I mentioned, we send out those 3 emails 90, 60, and 30 days in advance. And then if someone's license does become expired, we send out a letter that says your license is now expired. And I think one thing, if I was asked to clarify for a similar committee, I would say is that it's not unprofessional conduct for your license to expire. That is the way that a lot of people just choose to retire or choose to stop practicing for a while. The violation would be if someone provides services that would require under the scope of practice of someone who needs to hold a license. So if you continue to provide services after your license has expired, that's where the real issue is. And so that's the point of clarity there. But one thing that we do when someone's license does expire is we send them the letter, and in the letter it says your license is now expired. Please don't provide services under your previous license. If you do want to provide services again, you will need to ask for that license to be reinstated, and then it kind of clarifies that process. So I just kind of wanted to lay that out in case you had heard any questions about that committee meeting. I'm not sure if there will be additional follow-up, but we'll definitely be, watching and trying to improve our processes as well. And even though the focus was not on our agency, we want to be mindful of what the legislature is looking at, and we want to make sure that people are, we want to partner with people as much as possible to make sure that they are aware of what the expectations are, and we don't want to catch people off guard. And so I just want to make you aware of that committee. And then next week, I wanted to let you know, I just found this out yesterday, there are a couple of meetings that are taking place. There is another committee that is focused on health and social services that is looking at, they posted their agenda, so this is all public, but the agenda for the meeting, there's 2 days next week where they're going to be looking at potential privatization of hospital functions. There's some testimony there from individuals concerning nursing professions, but also some individuals from the mental health field and the state hospitals. The Department for Aging and Disability Services listed several times on the agenda. So they'll be talking a little bit about workforce and things like that. And so we'll be kind of keeping an eye out for those meetings as well. But that is taking place next Tuesday and Wednesday. I think one of the days is an all-day meeting from 9 to 4. The other one is scheduled from about 9 to 2:30. So I'll be trying to monitor those in between other meetings as well. And then just turning last to some updates from the previous board meeting. The board did meet on July 28th. And one of the major things the board is working on right now, you all spent a lot of time working through your unprofessional conduct regulations and making recommendations on changes. The 6 other professions and their advisory committees did the same thing. To assist the work of the board as they are considering all those recommendations is my staff has put together a giant Excel grid of all the unprofessional conduct regulations for all 7 professions. And what we tried to do is, as much as possible, we took similar items and lined them up side by side so the board could look across and see things like confidentiality and undue influence and things like that. And so they can compare the language. And as much as possible, the board is striving for there to be similar language between professions, unless there is a compelling reason why there should be some differences for one profession over the other. But the board is working through those, and I believe they will continue to work through those likely through the end of this year with the goal of submitting those out for public comment sometime probably early next year. But that's a really good discussion. If you haven't seen that grid, I think it's a really impressive thing that my staff was able to put together. So I really thank them for their time doing that. And I think it's been helpful for the board to kind of see across to see, some of these are just slight changes. But if you are someone who holds multiple licenses, it can be kind of confusing if you get a complaint against you and the language or expectations is a little bit different based on what profession you're looking at. So I think by the end of this, we'll have a real great set of unprofessional conduct regulations. And then just the last update from that board meeting, So a few years back, the board, there was a bill that was passed which authorized the board, if the board chose to do so, the ability to require background checks for licensure. And the board had not made a decision to go ahead and make that a requirement in the past, in part because there would be an additional fee for all individuals who would be subject to the background check requirement. And an additional requirement for licensure is something that the board really needs to weigh in terms of how important is this in the terms of at a time where we're really making a push for workforce. However, based on a number of the multi-state compacts that Kansas has joined over the last few years, the one for psychologists, SIPAC, the professional counseling one, and the social work one, all of those establish a base standard that would require practitioners to have a background check to practice under those compacts. The psychology one allows a little bit of time for states to come under compliance, but the other ones say, no, you can't practice under this unless you have done a background check. And when we look to our other states, the surrounding states, at least from what I've been able to find, they have required background checks as a condition of licensure. So we brought this to the board at the last meeting and said, based on the multi-state compacts and other factors, we would encourage the board to go ahead and make this a requirement. And so the board did agree to make background checks a requirement for licensure. They would be for individuals making the initial application for licensure, individuals reinstating the license, and then there's also our student temporary licenses, and those are not part of a pathway towards a larger license, so those would be required as well. And then also, we wanted to have a way for individuals to opt in for the background check if they are already currently licensed. That way they could become eligible for the multi-state compacts. So we have been working with representatives from the Kansas Bureau of Investigation, KBI, to see how that can be implemented. And there's still some technical steps for us to work through, but I think sometime later this fall, we'll be able to start launching the requirement for background checks. So that is something coming up. Once we have more information as far as the steps and how that would work, I can tell you for anybody who wants to do the background check, the cost is going to be $57, and that entire amount would all go to the KBI for them to do the background check. So our staff would be in charge of reviewing the information, verifying that there is no issue, or if there is issue, it would be something that our investigators would probably need to look into further. So there will be an impact on our operations. I am sure we will find some things in some of the background checks that our investigations will need to probably increase because of this, but the exact impact on our operations at this point, I'm not sure. So that's the news I have right now, and I will give you more when I have a better understanding of what we required. But with that, I'll go ahead and end my report and see if there's any questions on any items I discussed or anything else.
Any questions?
So just to clarify, so the background checks will be a deal, and it will start most likely in the fall.
Yes, and the statute that had been passed a few years back, it basically said if the board so chose to do so, they could get a requirement for individuals upon initial application for licensure, individuals wanting to reinstate a license, or also in terms of individuals that were involved in an investigation. So for disciplinary purposes, it could also be required in that way. It's a little, language is a little unclear in terms of people who are already licensed. If, how that would work, if they would want to opt in to be eligible for the multi-state compacts, but we're working through that to see if that's something that is already under the existing language or if that needs to be modified. So.
But it would not be, for example, I'm renewing my license, and I'm not asking out of panic. I'm just asking. I'm renewing my license in November. As a renewing person, I wouldn't need to pay for and do the background check unless we were moving in. If I ever wanted to be part of a compact option, which is less relevant right now as an MFT, but that would be a reason where I would opt in to do that.
Yeah, well, we had brought
right?
to the board, right. We brought to the board basically just saying three groupings of people based on the language in that statute. One was individuals applying for licensure, so in the initial applications. And so if you were applying for a different type of license, then that would be subject to the background check. If these are individuals who had either let their license expire or had been suspended or revoked and they needed to reinstate their license, that's the second group if you're reinstating a license. And then the third group would be for the individuals who are seeking the student temporary licenses. And so
Okay.
but aside from that, if you have an existing license and you're renewing it, we did not ask the board for authority to require it from existing licensees upon renewal. It's only if you're seeking a different type of license or if you need to reinstate a license.
Thank you.
And I think, Dave, we talked about the turnaround time on those background checks too. So I think there was, don't want to create delays. But it sounded like the turnaround time was pretty reasonable.
Yeah, what we were hearing is that usually about a week, if not more quickly. Now, at the beginning, I'm sure there's things we're going to have to work through to kind of figure out the process a little bit, and we'll want to make sure that we have clear instructions. And I am assuming that once we have everything in place, we will put it out a date to let people know when that would be a requirement, and then also to clarify, Chris, like what you had talked about, would this apply to people with an existing license or not? Because I'm sure we'll get that question from people, and it's a reasonable question. So, yeah.
May I offer a question that also is a compliment to your to the agency? Well, this year our students in our program have just been blown away by how quickly since their degree has been posted, they've been receiving their information for like a temporary license. It's just been really, really impressive. And it means a lot to our students to be able to graduate and have that turnaround so quickly so that they can move towards operations. So I want to, from an institution, I want to thank you for how well that's working.
Well, thank you, Chris. I appreciate that.
And I think part of it is, students are filling out applications in advance, so things are ready to go. Which leads me to, could I, if I were a student graduating, let's say in July of next year, could I do the background check in advance of part of the application? Could I do a background check prior to my degree being posted? Does my question make sense? So that then once my license, my degree is posted, the background check would already be in place? Or is that something that would be part of that procedure once they get the temporary license invitation? Part of that would be, you got to go do a background check.
It's a great question, and I'm not sure that I have a complete answer on that. I have been told that if someone has a background check that they recently did for another purpose, they wouldn't be able to share that information. So if they did one that was employment-based, for example,
right,
but it was very close to them applying, they couldn't just say, well, I just did one, can I just share my results with you? They would have to be separate. But in terms of whether it could be something that would be at the beginning of the application process, I'm not sure we have down those types of mechanics just yet. There are some professions that allow people to take certain steps earlier than others, based on what the national associations will allow for things like testing and things like that. But we'll try to look into that, because we don't want there to be a delay. On the other hand, if there should be something that would come up in a background check, we don't want to issue a license and then find this person should not have been practicing. So we'll try to make sure as much as possible that we can put that towards the beginning of the process. So if there is any wait time, that's not going to be something that'll hold things up for people. So. But thank you for the compliment, and I will pass that along to my staff. I know they are trying to help people as quickly as possible, and trying to stay on top of things once they have the information they need to move forward. So appreciate that feedback.
Yeah. Thank you for your work.
Any other questions or comments?
I would just echo what you said, Chris. I've a lot of students that I've worked with that have graduated, how quickly that process is going. So just wanted to echo that and say that I've observed that as well, and really appreciate that hard work.
Well, thank you. Appreciate that.
I'm one of those people that used CE Broker right before my license was renewed, and it was quite simple and easy. I will say every 2 years I aspire to not be that person that does all their CEUs in the last month. And tried to upload something recently and it said like your license like window you're doing outside of your window. So I need to do a little more digging into how to say like, okay, I got approved that time and now I need to start a new window. And it seems like what I've been running into is you maybe need to have a paid account to do that, but I'm not 100% sure. So, but it was very simple and I have encouraged other people who asked me about it to use it.
Thank you for the feedback on that. Appreciate it. And as someone who needs to do continuing legal education hours every year, I empathize and I strive for that too, although some years are better than others. So, yeah.
Right.
Okay, great. Thank you. Well, we will move on into the old business items. The first of which is the continuing discussion on the survey. We had asked to look and review questions. I think Dave gave us the direction on pages 15 and 16 and on 37 through 47 so we could have some discussion. Dave, do you want to lead us into that?
Sure. So you may recall, we looked at the survey report at a previous meeting, and the report itself, when you have everything, it's a pretty lengthy report. Your report for your licensees was 77 pages, but we did say don't be intimidated by 77 pages because really we tried to put summary information towards the beginning, but we also wanted to, as much as possible, preserve the voices of the people who had taken the survey. Because I feel like there is a lot of context when you're looking through responses, and we want people to be able to dig deeper into those open field responses. But going through this many questions, it can be a challenging process. So we asked the advisory committee to focus on 2 specific questions this time. And I'll go ahead and share my screen, and I'll just frame the discussion on those 2 questions. So as Mary mentioned, the 2 questions that we asked individuals to focus on for this meeting involved question 13 for the LMFT license category, and also question 12 for the LCMFT. And the summary information begins on page 15 and 16. And so this question asked basically if licensees had observed any practice-related issues in a negative sense, and or areas where practitioners appeared to need more continuing education training in a certain area. And just as sort of a recap for the summary information for the LMFT responses, 48 individuals answered that question. They did share some information, while a number did say they didn't see any negative issues. Other individuals who did highlighted things like issues relating to insurance, diagnostic concerns, a lack of self-awareness, and a lack of continuing education options. Some of the ethical issues that were highlighted were standards are not consistent across professions, no guidance for resolving professional disputes, current ethical guidelines are in need of updating. For the LCMFTs, 175 LCMFTs answered the question. About 44 individuals said there were no practice-related negative issues that they would highlight. But for the individuals who did highlight issues, our staff who reviewed the responses and tried to summarize those broke them down into about 6 main issue areas: ethical issues, court issues, artificial intelligence or AI issues, telehealth issues, areas needing more education or training, and other issues. And then in terms of the ethical issues, some of the ones that were highlighted included things like boundaries of clients, social media, AI use, unethical billing practices, HIPAA violations, dual relationships, practicing outside of one's scope of practice, abuses of power, manipulation, use of non-evidence-based practices, personal biases, marriage and family therapists providing legal advice, and client exploitation. Some of the court issues were noted. As far as AI issues, some of the items noted were a lingering risk of confidentiality breaches, concern about general AI use in terms of practice, a need for ethical and legal guidance on AI, and a desire for more education on the potential implications of using AI. And then in terms of the individuals who talked about needing more education or training in terms of what they were seeing, some of those categories included working with insurance and billing, trauma, diagnosis, working with children, documentation, treatment plans, EMDR, crisis, knowing when to refer out, diversity, and also suicide prevention, assessment, and ideation. So just wanted to do a quick recap on that question. But perhaps I can go ahead and turn it over to you. And I'm curious what some of your thoughts or takeaways were looking at the summary information and also looking at the open field answers in the back of the survey. I'll turn it over to you, and you can talk about either the LMFT category or the LCMFT or just overall responses that you noted.
I'll touch on the AI. So I have lots of notes, but we have been talking about AI for a while, and it seems like AI, especially in the LCMFT responses, was a big category. And I think I mentioned a while ago that some of the like simple practice has implemented an AI usage, and I've heard from other places in town that are using AI. And so it does feel like we're kind of at the point where it's like, maybe instead of just like talking about AI, we maybe need to like actually write up a draft of like, this is what AI guidelines should be, and then like move forward with talking about that at the next meeting and presenting, Mary, maybe presenting at the board. Because it just feels like we can't just talk about it anymore. Maybe we need to actually make some actionable steps forward.
I appreciate you saying that. I was in a meeting earlier this week where another group is looking at AI in the mental health, because there were some really disturbing things around chatbots that were discussed in that, and chatbots who look like therapists and are not actually treating professionals. So that group also said it's time to probably look at something, and a colleague had some language from other states. Dave, I did ask her to coordinate with you, and kind of we could get some suggested language. Not that we would propose legislation yet, but there are some states that are moving forward in that, particularly in those areas of the chatbots and places like that. And I think, Heidi, your point is, I think most electronic health records at this point are incorporating some closed source AI. And, I agree. I think probably some suggested language. There's a lot of difference between an open source chat GPT and a closed source electronic health record that's protected in cloud and those kind of things. So I think that's.
And even the one that I know the most about is the note takers, where they listen in on sessions and then AI make a transcript, and AI creates a progress note out of that. And I did a little bit of research, and Kansas is a one-party consent on recording. So technically, let's say a person here in Kansas wants to use that, they technically don't even need informed consent to be using that, but that doesn't feel very ethical to your clients. And so I think that, in that case, it should be like, we should have some guidance on having informed consent with all AI and being clear about how it is being used, whether it be for note-taking purposes or content creation or chatbots.
Okay, good note. I mean, I think it's probably a similar conversation across all the advisory committees, because you're right. It's like, how long can we just continue to talk about it without maybe trying to move forward in a direction? I think those are good thoughts.
Well, and I'll go ahead and spoil something.
Okay.
So, we've been asking the advisory committee to focus on a couple questions for each meeting. That way we can dissect the report a little bit more easily, and give some of these questions enough time to really be thought through and discussed. For the next advisory committee meetings, what we have been asking each committee to look at, one of those was the question on AI. So just as a preview for the next meeting, we were going to be asking individuals to look at the AI question, which is question 16 for both professions on page 22. I'll just go ahead and tell you what the other question is right now. The other question is going to be the focus on telehealth. And so that's question 14 for the LMFTs and question 13 for the LCMFTs, and it starts on page 17. But those were the two areas of focus for the next meeting. So if we did want to have a more in-depth discussion into AI, I think that would line up just really well with looking at the AI question specifically at the next meeting.
Yeah, I appreciate that. And I certainly have thoughts about telehealth too, because in the AAMFT standards, there's pretty specific guidance on, if you're going to be a telehealth provider. And maybe because, a good portion of our MFTs in the state are not AAMFT members, where they might miss some of those pieces in upholding those ethical standards. What struck me is this guidelines for resolving professional disputes. I thought that was interesting. I think it's the social work practice where they have pretty clear guidance on like peer-to-peer outreach if there's some type of professional concern. And we don't give that high-level guidance or specific guidance. So I thought that was kind of interesting. In our profession, I mean, we sort of deal with it, I think, as it comes, but it's not as prescribed, I think, as in the social work standards. So that's something that stuck out with me. And then quite frankly, a lot of these issues to me looked like issues that if a licensee were getting good supervision, then some of these things, I mean, when you talk about boundaries with clients and social media issues, which by the way, I would just comment that as we see complaints, I mean, these are issues that are relatively high in volume, particularly around social media and dual relationships with clients and boundaries that involve social media. I mean, I think these are areas where we're seeing just rise to the top, where in our culture where technology is so accessible, everybody's on social media, seems like maybe being more concrete with some practice standards for people might be a helpful tool.
I've had some conversations lately. This has been with practitioners in the MFT field and also other professions. And I need to go do a little bit more reading on this. It kind of falls under the client exploitation piece to a degree, like sending surveys out so that people will respond. And, I work for an agency, so we do it more from an agency standpoint. But there's been a move in other spaces to seek feedback after a service so that we can get specific feedback on like practitioners and providers. And one of the conversations that I had, and I want to say it had to do with this piece. I don't know. I never equated it with client exploitation, but they felt like that we were forcing people to give us feedback, and which was really interesting because we're just offering, like the idea was just to offer them the ability to, if they wanted to give feedback. And I hadn't really thought about it under client exploitation before. And so I need to do a little bit more reading from the MFT side of things, what all would be considered under that category. I think there's other professions that clearly talk about eliciting feedback. And so it was just interesting when I saw that on here when I was reviewing it for today, and I had just had that conversation. I've never viewed that as client exploitation, but I can understand, I guess, some of that interpretation as well. But I would be curious what other people, like what some of those struggles are with exploitation that they have been having to navigate. So.
Mary, I want to go back to what you said. I do think that there are lots of very specific ethical complaints in the open-ended questions that, yeah, a lot of that can be addressed pretty well through good supervision. But the thing that stood out to me that I think maybe supervisors might not be equipped to handle as well, and that I think could be helpful for the board to step in, is guidance on working with the courts. There's, that I've been to court a lot, and I've always consulted with like my agency staff, but I think it could be very helpful to have like lawyers help create like how to respond to a subpoena. Like, for example, I have a supervisee who's gotten subpoenaed through email a few times, and I'm like, "Ugh, I don't actually know if that's allowed," and just having to give kind of advice on what I'm like, I guess if you can comply, comply. I don't know. So I think there could be a lot of benefit in, this is how to respond to subpoena. This is how to go to court. This is maybe what you can and can't speak to, because a lot of that does fall outside of what supervisors would be able to provide, because they're not lawyers and they're not trained in the court system.
Yeah, good point. Good point.
I don't want to cut the discussion short, but if we are kind of turning our focus towards supervision, yeah.
It was a natural segue, right?
It felt like a natural segue. So I'll share my screen again and we'll talk about the question 15, which does talk about supervision specifically. Question 15 for both levels of license said, over the past 2 years, have you experienced any negative issues involving supervision? If so, please explain. And for the LMFTs, 56 LMFTs answered the question. 46 indicated experiencing no negative issues involving supervision, which I always try to highlight that sentence when I go through these, because I feel like when you have other responses, they sort of are magnified because they are a little bit more, or they're a little bit different from each other, and there's more specific. But I do think it's probably something notable that 46 of the 56 had the opportunity to highlight anything negative involving supervision in the last 2 years, and they said no, nothing to note. But we do want to recognize the responses that they did note some issues involving supervision. And some of the issues that were noted here talked about supervision and the financial aspect of just receiving the supervision, some difficulty there with the burden, having a lack of guidance and support from supervisors, and instances of supervisors inserting personal biases. And then for the LC MFTs, 175 LC MFTs answered the question. 35 respondents indicated they do not provide supervision. So well, it's hard to kind of know exactly why someone would respond no. When you do have a fair amount of people who are not providing supervision, that may be why they have nothing critical to say about supervision if they're not directly involved with it currently. And we did ask about the last 2 years, but 115 respondents said they have nothing negative to report, at least for the last 2 years. Some individuals did mention having positive experiences with supervision and supervisors, and others reported a severe lack of training for supervisors. Some of the negative issues that were highlighted, my staff categorized into 5 categories: training plans, training plan amendments, board-approved supervisor requirements, underprepared recent graduates, and other issues. Some of the other things that were noted in terms of the training plan amendments included clarity around when exactly they are needed, as well as supervisees failing to submit amendments and consequently having to redo hours. There was also individuals waiting for training plan approvals, and then the role of emergency supervisors. Shifting to board-approved supervisor requirements, they mentioned a lack of available trainings or educations, Also that the requirements may be too strict, making it too difficult to become a board-approved supervisor. And then other issues that were noted as far as underpreparedness of recent graduates. Some graduates struggled with work-life balance, self-sufficiency skills. Recent graduates are unable to be proactive, and poor ethical instincts. In terms of some individuals, they did focus on graduate programs, expressing a desire to understand why programs are producing less prepared graduates. Other respondents indicated that it is challenging to find supervisors and or supervisees. So I will turn it over to you and see if you had any thoughts or comments or takeaways from the summary information, or by going through and looking at the open field responses, specifically relating to the topic of supervision.
Well, I think what stood out for me was this a concept of underprepared graduates. And anecdotally, I'm hearing that in other professions as well. That just seem, and it goes along the lines of, not being able to test, which we've talked about, but just maybe having a skill set that's lacking in there. And I do hear that it's not just for MFTs and the conversations I have. I think it's more widespread in that. So that was sort of interesting to me too. At what level should we expect someone to be prepared when they complete? And that's, to me, the importance also of that supervision, that minimum 2 year time for people to become fully prepared. So that was sort of interesting to me too.
I do wonder though how much of that is COVID specific, because in the past 2 years, you're working with people who were doing their training in COVID. And I mean, I know some of the graduates in that time period hadn't seen a client in person their whole program. And obviously a lot of that has switched back to kind of the norm. And if that lack of preparedness will jump back to, oh yeah, this is somebody who they're insecure because they're a new therapist, but they're not lacking informed consent. They're not lacking basic diagnostic skills, things like that.
Yeah. And the other piece, of course, and I've heard a lot of commentary about the board approved supervisor process and requirements. And it just made me think, would it be beneficial for our advisory group to look at the subset of requirements? Because I think generally speaking, I remember these conversations back in the day. I mean, it really was with the intent to make sure that supervisors were prepared to do supervision for MFTs, and maybe the categories are too stringent and we could look at them differently. I think that to me is something that I've heard enough of, that I wonder if that could be something this advisory committee would look at again, and maybe just broaden, while not eliminating, but broadening the categories so that people felt like it wasn't difficult to find a training out there from any CE provider that would cover ethics of supervision and, those kind of things that we'd asked for in that.
I agree with that, especially with I think there was comments about having a very hard time finding supervisors in Western Kansas. And how maybe, and I remember when I tried to become a supervisor, feeling like it was almost impossible to get through unless I went to a PhD program and got training that way. And I will say that the supervisor training that I took, I don't think was very good either. It felt like it was somebody who knew how to check all the boxes in one afternoon, and then they did. And then even though you feel like, oh, I'm a great clinician, you're not quite prepared how to handle supervising. So I think there could be a lot more support done there. I even thought, like, David, we have some of those trainings that we create, and I was like, I wonder how hard it would be to create trainings for approved supervisors. And maybe that's not the way we should go, but it does feel like a high level of entry to figure out how to do it, how to get into state approved supervising, and then also how to feel like you actually can do it based off of the training.
You know, one thing in talking to the other advisory committees, there were a couple members of a different committee that expressed a little bit of question about if all supervision could be done by televideo. And that is something that was changed a few years back. But I know if you are licensed in multiple states, some of those flexibilities in other states may have been a temporary thing just for the pandemic. And then once things were removed from that, sometimes those states went back to their normal requirements and their rules. And in Kansas, once it was opened up, it was done with some intention by the board to allow people to meet those requirements so that it would address some of the issue as far as geographic proximity. If there's someone who no longer needs to be, you know, right in your area. And now there's still preference by some people who may really want to have in-person supervision versus by televideo. But that was something that I picked up, and we're going to probably at least ask a question about or put out information about through the jurisprudence project we're working on to make sure that people are aware that all the supervision hours can be done by televideo. So that'll be one thing we'll highlight to kind of share more information about and make sure that everybody understands that.
Yeah, I think those are good points. I mean, my preference is televideo with supervision, just because it's an efficient way to meet. And usually episodically, then we'll have face-to-face supervision. I can't say that a quality of that is different from what I provide face-to-face, but I do think that's been a Kansas flexibility that's been appreciated. So yeah, that's interesting. Is this group interested in looking at the supervision piece in another advisory committee meeting? That's something that we'd like to bring forward as an agenda item.
I think so.
Sure.
Everyone else, okay, great.
Well, it seems like we've had a good discussion about both questions. Any other comments about either question before we talk about next steps for the future meeting? If not, I said that kind of gave a spoiler earlier, but if we can continue to go through this report and take a couple questions at a time, I think it does allow us to have a good, productive discussion here and identify issues maybe the advisory committee can focus on for future meetings. So with that in mind, we're asking each of the advisory committees for the next meeting to focus specifically on the question on have you observed any negative issues concerning telehealth or remote practice? And that is question 14 for the LMFTs and question 13 for the LCMFTs. And the summary of both questions begins on page 17. And then also the second question to focus on for next time would be the AI question. And that's question 16 for both groups of licensees. And a summary of that begins on page 22. So if you could review that between now and the next meeting and then come to the next meeting ready to discuss like you did here. I think the discussion today was really good. So if you can kind of replicate this, we can get into more of these topics. And then, I thought, Mary, you had a good direction in terms of saying, we had a discussion about this, and then what pieces can we take that can, help drive the work of the advisory committee in the future. I think that's a great way for this process to work.
Great, thank you. Okay, well, we will move forward to new business, and the next item is recommendations on new advisory committee members. I know Dave will provide some context for this too, but I think our goal would be 1 or 2 each year so that we can continue to make sure that we don't have everyone expiring terms at the same time. So I think Dave has given us a lot of really nice applicants and candidates to look at for advisory committee. And I know you have some direction from how the board looks at advisory committee members, so that might be a good place for us to start and then begin talking about nominations.
Sure. And just before I get into that process, I did want to highlight there was one other item under old business, and that was just a reference to discussion on artificial intelligence. I just had one up I wanted to share.
Sorry about that.
No problem at all. We've talked a little bit at past meetings about federal legislation, specifically the appropriations bill that had some language that said, if it was passed, it could prohibit states from being able to regulate artificial intelligence for up to 10 years, I believe. And so that would be an issue for us as an advisory committee making recommendations to the board if we were prohibited, or at least half of our area would be impacted. And so I did want to let you know, in terms of an update, from what I have been reading, it sounds like that language, while it did pass the House version, it was removed when it was going through the Senate. And so the final version of the bill did not include that language that would prohibit states from regulating artificial intelligence. So that's not something we have to worry about through our work looking at AI, but something like that could come up in the future. So we'll just continue to monitor federal legislation. But I wanted to kind of wrap that discussion up since we had talked about it previously.
Thank you.
But yeah, moving to the advisory committee process here. So this is kind of a recap. These advisory committee positions last for 2 years, and they go by the fiscal year. So they start July 1st and then end June 30th, 2 years later. Advisory committee members can serve up to 4 2-year terms. There was a recent change in the advisory committee policy by the board, which does allow people to come back to the advisory committee if they had previously served their maximum length of service of 8 years. So as long as there was a 2-year gap, individuals would be eligible to come back to the advisory committee after at least 2 years off, and then they can serve up to 4 more additional terms. But there does need to be at least a minimum of 3 non-board members on the advisory committee, and no more than 10. And so currently you have 6, which means you could add at most 4 people, but it may make sense to add fewer, so that way there would be potentially more openings in fewer years, and you could stagger the terms. So not everybody is coming up at the same time. But those are some things to keep in mind. There's also some notes in the advisory committee policy that talks about some of the things to keep in mind when reviewing applicants. You're familiar with the discussions that take place here. So as you review the applicants for the advisory committee, some things to be thinking about. There is some language in the advisory committee policy that talks about wanting to have sort of a spread of levels of licensing, if that can be achieved. Also, geographic representation. The question does come up, do individuals need to live in the state of Kansas? That is something we have brought to the board for clarity in the past, that the board has not said that has to be a requirement, but it can be something that is weighed in. But in the past, there has been sort of a preference that there is a spread of members of the advisory committee across the state if that can be achieved. And at times, people have been added to the advisory committee who have lived out of the state. So that is still something possible too. And then as you go through and you look at the other factors that are mentioned in the advisory committee policy, you can weigh other things that people can contribute, some of the things that are mentioned in that policy there. But I wanted to highlight that for you. And so do you have any questions before we begin? I guess the thing is, the advisory committees, when they make recommendations, you can do it a couple different ways. You can take a formal vote in terms of recommendations on a new member. Alternatively, you could do this by reaching consensus, where there is no official vote, but it is clear consensus of the committee to have these people added to the committee. I have seen it done a number of different ways. Sometimes advisory committee members go through each particular applicant. However, what I think has worked a little bit more efficiently is when people talk about maybe the top 2 or 3 candidates that stood out to them. And then when the other members of the committee do that, sometimes there can be a natural consensus if it turns out that the same 2 or 3 people stood out to the majority of members of the committee. So that may be a good place to start, and then try to narrow it down maybe with votes if you have to come to that. So I will turn it over to you, Mary, but I just kind of want to outline what the policy talks about. You are within the requirements in terms of minimum of 3, max of 10, but the most you could add would be 4, but it may make sense to add fewer. So I'll turn it back over to you.
Yeah, thank you for that. I think ideally one or two each year is going to probably serve the committee best to keep some of them, the history and get people up to speed. One thing, I noticed already in our current composition, we've got two out of Overland Park, two out of Manhattan, Hutchinson, and one Hutchinson, one Wichita. So I think, geographically, I think there's things to look at there. I would open it up with, did anyone have a strong candidate that they really wanted us to consider today?
May I ask a question first?
Yes,
A number of these people are graduates of
yes.
Friends where I'm at. Is there any kind of conflict of interest of any kind I need to worry about?
That's a great
Oh,
question, and it does come up sometimes. I know, in certain times we say, board members and advisory committee members should be aware of conflicts. And this type of a process, you're bound to know individuals who apply. And so you don't need to disqualify yourself, but it's up to any individual. If they would want to do that, they always can recuse themselves. But what we've told people in the past is that if you are aware of somebody and their particular strengths, that might make a more informed decision in this process. So we'll leave it to each individual, but it's not uncommon for someone to know most people that apply or even a handful. And so you don't have to recuse yourself from this process. But if you choose to do that, that is perfectly fine too.
thank you.
Yeah,
I
great question. I think I'm a reference on one of them if you didn't notice. I think. Yeah.
There were a few that kind of stuck out to me. Well, I did have one question. David, you were talking about, do they have to live here? And I think Camille Green was still on the
Yeah.
one you sent us yesterday. I looked at all of this last time we met, and it looked like she maybe lives in DC, maybe.
Yes.
So it was just like a question mark, I guess, for me, which I think could be it could be valuable for a lot of different reasons, but one of the other ones that stuck out to me was Stacy Hodges working with the VA, and I just think that like some representation with that population and that expertise could be really helpful. It's a really complex system to navigate in any profession. Um, and yeah, I just think that could potentially be very valuable to this group.
Thank you.
Camille Green made my list as well. I have four. I couldn't decide. But because she's worked in so many different settings, she's worked at the military, she's worked in community mental health, she's worked in private practice. But the DC thing was, it could be good in the sense like she might be hearing from other state, like Washington, what's happening with their AI and what's happening there. But she did serve in the Manhattan area, which is something that obviously we have a lot of Manhattan representation. But she's also a person of color, which we don't have represented very well on our board at all, actually. So she made my list. My other, we don't have to do all three of these, but I'll just list my other three. Rainisha Hunter. So again, she is also a person of color. She runs a group for women. I found this out on her website. And so that's like kind of, I think, a big population that's drawn to her, and they're not necessarily engaged in therapy. They're just engaged in this group. And I thought that could be interesting. She has a background both clinically and she works, I think, from what I understand, she teaches at a college. I'm not 100% sure about that. And she teaches at Butler Community College, which, from my experience, serves a lot of military members and their family. Ryan Miller made my list because he is pretty well connected through AAMFT. And I thought that could be helpful with having somebody quite intimately connected and knowing what's happening at a national level. And then lastly is Jim Paulus. And he was kind of high on my list because he lives in a rural setting and we don't have anybody living in a rural setting that is working with us. But I was really unclear on his educational background, if he
Mhm.
was an MFT or if he was a psychologist and then did more. I wasn't sure what was going on there. But those are the four that stood out to me.
Yeah. I'm very similar with you, Heidi. I wasn't clear on Jim. I did like the fact of his geographic location. I personally, my opinion is, to be in Kansas is sort of important to understand what's going on. And while the board didn't completely weigh in on that, I mean, if you're Kansas City, Missouri, I don't think that's a big leap. But I think for me personally, that's why I knocked out people who weren't residents of Kansas or neighboring Missouri for that reason. But your list is really close to mine. So, and also, think Stacy Hodges would be a good candidate too. Did anyone have any candidates they wanted to suggest other than the ones that were mentioned so we can start narrowing?
I thought Dr. Drake was a good candidate too.
Let me pull up. Yes. And oh, yes. And that'd be I was looking at the Manhattan piece for
Right,
that
right.
too.
That was,
Okay.
yeah.
So we have several good, I mean, really good candidates to look at here. Um, again, we could look at it as one or two now, and then if there's interest next year, continue to look at what our top categories of. I think we could maybe for clarity knock out Jim because we just don't understand exactly credentials.
Sounds like also Camille because she's in DC.
Okay. So Adriana, yeah, and Stacy and Renisha are on our list.
I threw Ryan out there as well, Ryan Miller.
Oh, right. We have had in the past on this advisory committee, K-State representation, and it's been really helpful in our conversations and discussions. So that certainly is a strong candidate in my mind too.
Is that Adriana?
Yes.
From, not that I dislike her, but from my understanding, she doesn't work for the program. She works at the vet school there. So she provides support to veterinary students since it's such a high stress degree. Not that she's disconnected from the program, but she's not part of the program like how Marcy was.
Okay, gotcha.
I thought that was really interesting. I hadn't talked to any providers that do that, and I thought that was really neat for College of the Veterinary Medicine. I had her on my list too.
Stacy has served the VA in Missouri and now is in Kansas. She's, putting her up in Leavenworth, which is a kind of part of the state that I don't know that we invest in. She has a nose for detail.
Mhm.
She's kind of a policy hound. I think would be a person who would, probably have several questions for David about, here's a word that's used in this statute. Is that going to, I mean, so to her credit, I'm trying to say she has an eye for that kind of thing. I'm just offering that.
Yeah, I went to school with her. So
Oh, yeah.
yeah, so this is sort of where we get into the process of elimination. We've got some really strong candidates.
What is our, so obviously Chris is here. What is our female to male ratio on the board right now?
Well, we have Jim, who's our public member, and Chris on this committee
Out of 6, is that correct?
out of 8.
Out of 8, okay. Does that feel important to have another male, or that doesn't matter?
I don't know. For me, I think there's other demographics that might be important to represent just culturally, so that's also on my mind.
I would agree.
So, I mean, I mean, if I were going to look at Renisha Hunter as an example, and then I, I mean, I think I don't know how everyone else feels, but I think it's also nice having an LMFT that sort of breaks up our all clinical level people as well.
Who are the LMFT candidates?
Renisha Hunters and
Oh,
Beth
she is.
Fate. But
Okay.
they're both Wichita area.
Okay.
Just I'll just stick my neck out there. Um, I would like us to focus on Stacy Hodges and Renisha Hunter as potential candidates and recommendations. I'm getting a nod from Chris,
I
nod
support
from Diane.
Mhm.
You support that too?
Mhm.
Heidi?
Yeah, sure. Yeah, for sure. I like Renisha as well. I can definitely look over Stacy, but I also trust you all saying that she's great.
Okay, well, I'm most comfortable at adding 2 just because I've seen a big exit all at once. So, and we could still continue to look at these applications if we felt like we wanted to add more. But I would go ahead and move forward just saying I'd like to make that recommendation to the board chair that we add those 2 advisory committee members. Awesome. Thank you. It's great. Do you want a formal motion on that, Dave, or did it sound like we had consensus?
It appears that there's consensus by the group. So you can always check and see if there's any objections, but it appeared to me visually and verbally to be consensus. So
Great. Awesome. Thank you so much. Okay, my next item is the discussion on alternate pathways for licensure, and I know you've been doing some work on that, Dave.
yeah, and so this is a topic that the chair of the board had brought up at a board meeting, specifically looking at, he would like the advisory committees to each have a discussion about possible alternate pathways to licensure that may not require passage of a licensing examination. So since that time, it's been referred to the advisory committees to think about and discuss. You may or may not want to make a recommendation on this ultimately, but I wanted to try to get some information for you so that you could have an informed decision on this. I am still gathering information. What I'd like to do is provide back information to you about what states require passage of a licensing examination, and if there are any that have pathways that do not. And I'm not necessarily talking about long-term practitioners. I'm really talking about more entry-level paths currently that would not require passage of an examination. So unfortunately, I don't have a lot of information for you today to look at, but maybe I can turn it over to you if you have any initial thoughts on this. My goal for the next meeting is to be able to provide you sort of a list, at least from what I could find, in terms of what states require for licensure, and maybe if there are others that don't require a licensing test, at least a short list of those states and what they've looked into. But I'll turn it over to you for maybe some preliminary thoughts or questions, or if there's something in particular you want me to look into and bring back, I can do that as well.
Can I clarify? The question is, are we wanting to drop the licensing exam?
Not necessarily drop the exam. It's more of the chair of the board was wanting to have a conversation and have the advisory committees discuss if it would be beneficial to consider creating a pathway towards licensure that would not require the test as a component to that. So not to say that it would be discontinued as a requirement for anybody seeking licensure, but if there was I guess, and I think in his mind, from some of the comments that he made, would it be beneficial to consider another route if someone was a long-term practitioner, but was unsuccessful at passing the test? Would years of practice be satisfactory? For example, if someone were an LMFT and they had passed the test at that level, but they were unable to pass at the higher level for independent practice, but maybe they had practiced under supervision for 10 years, 15 years, something like that, with those 10 or 15 years of practice and potentially something like an attestation that this person would be able to practice well independently, would that be something that the advisory committee would say we want to consider allowing that as an alternative? And I know Kansas is a little unique in that some states only have one level of permanent licensure, and that they have some other things that they might call, provisional licensure or temporary licensure, which people can stay at for a certain amount of time, and then ultimately they want everyone to get to the independent level. And whereas we have a little bit more flexibility in that we have the permanent level for the LMFT and the permanent level for the LCMFT. But I think that was the focus of the chair of the board. And I've heard some discussions in different advisory committees. This was not a directive from the chair of the board that said, advisory committees, you need to develop this. It was more of, I would like each of the advisory committees to have a conversation about this if you think this would be something that would be a good idea. And then if there is a recommendation, then that could be forwarded back to the board. But for you to make an informed opinion, I wanted to try to collect information on what other states have done in this area. Because if we're the outlier, that's important to know. If we are behind and other states are already doing this, I feel like that's something for you to know as well. So I just don't have that information yet, but I should have it for the next meeting for you.
We have any way to know kind of how many people, I guess, without knowing what those pathways are? This is, a great example, but I think of a few things like how many people would this potentially impact? So is it a workforce issue? I start to think about reciprocity, like if I get a license here under an alternative pathway, does that impact any kind of reciprocity to another state? Would that impact anything related to compacts? Not that we're currently in that situation, but those are the three things that come to mind for me. If I'm listening properly, maybe I'm not.
No, I think you're on track, and there is no current development of a multi-state compact, but a lot of those compacts do establish minimum requirements, and at least all the ones that have passed so far do require passage of an examination, like SIPAC for psychologists, professional counseling for professional counselors, and then social work. Now, the social work does include some language allowing for an alternative if it can be agreed upon, but one has not yet been for the social work profession. So basically, there is a requirement for a test as of right now for the social work. But yeah, multi-state compacts and eligibility for that, I think, is something to be thinking about here. Reciprocity is interesting because some states have passed reciprocity rules that look on have you held a license with a similar scope of practice. And if that is all that is specifically stated in the reciprocity language, it may not explicitly require passage of an examination. So
Good point.
that's something to think about with that. But maybe it might have been the case where states passed the reciprocity law, the universal licensure, with the assumption that all states were requiring a test. And so that could lead to complications there if there's a state that is not. But from my end, I want you to have the good information so you can have good discussions. But yeah, those are definitely things to be weighing and thinking about.
Yeah, I think those are really good points, and that a lot of the conversation started with, I mean, even in my own organization, where you have people working on a temp license for 2 years under supervision. They're good clinicians, good therapists, and can't pass that test and end up not being able to continue in the field. And so those are the kind of scenarios where we know the skill set is there, but haven't been able to pass exams. So I think there, to your point, Chris, if we did something like that, there's a real disclosure of, to the licensee and understanding what the implications of that would mean for them potentially.
There's also a part of this that rarely gets talked about, and that is, when you have a pass or fail, and it seems to be all or nothing. There's rarely talked about, how many people are within a few points of passing versus people that are really far away from that pass point. And for me, as someone who oversees licensure, you know, I would want, if there was some consideration on something like this where someone was struggling to pass the test, from a public protection standpoint, if I knew that someone was just a couple points away and it appeared to be something like a test anxiety type issue, that's a different conversation than if someone took the test and scored 10%. And I would wonder, how did they get this far through a program where it appears that they did not understand the knowledge that would be required for this exam, because that's quite a bit different. Someone who is just below the pass point versus someone who had 10%. But when you're looking at just a pass or fail, that kind of content is lost in the discussion. So I think that we want that information, or at least to know how many people are close to passing versus how many people are far away. And that may come down to trying to get information about what is the average score versus how many people pass and how many people fail.
I'm hesitant to say this because in my head, I'm starting to think, does the national exam, is it predictive of what a safe, effective therapist would be? And I'm not ready to say no, but you're raising some interesting questions, David, that are intriguing to me.
I mean, we talk about the exam for other professions, and there has been a big focus in the social work world, and they have done a lot of things to, I think, reconsider their testing. And so they are moving from four option multiple choice questions to 3, so that there's fewer things for the test taker to read. So it's less of a speed reading thing. And they've said that most people don't take the fourth option anyway. It's always disregarded, and so it really doesn't affect the psychometrics. But there's other things like speed reading or test anxiety, and these things that are really outside of the testing material, that they're trying to isolate. And then they've even partnered with a group called Fifth Theory, which, if you fail the test once, that group follows up with the person and works with them on test taking strategies for the next time they take the exam. So there have been some other associations that have really been examining the testing process. But
I don't know if it's still the same, but back in the day, this is way back in the 1900s when I was in grad school in California, you had to do an in-person interview. I mean, I don't know if that's still the case, but then that would be fraught with potential, because you don't really have you'd be interviewed, you don't really have a way. If somebody said, no, you didn't pass, you couldn't confirm how you didn't pass the oral exam, and that became just rife with opportunity. So that there's an objective thing about a test, that I value. And at the same time, is it the summative measure of what makes a person effective in this? It's just an interesting question.
yeah, and I mean, psychology is dealing with that. They have a test called the EPPP, and
Mm-hmm.
for some states they had additionally an oral assessment, and they
Right.
would describe the EPPP as a knowledge-based test, and the they
Yeah.
would describe their oral exam as a skills-based assessment. But you're right, when you do the oral version of that, it's potentially subjective, and there's too much subjectivity to it. And so
Right.
for that association, they actually developed an alternative called the EPPP2. But then there was a question of, should there be 2 tests required for licensure, and what would the impact of that be financially? And then people
Right.
have difficulty passing both tests. And so ultimately that profession is working on building a new test that incorporates components of both.
Mhm.
The knowledge base and the skills based into a new version of their licensing test. So it'd still be one test, but they're working on incorporating that without some of the
Mhm.
issues. But yeah, that is one of the issues is, people who have talked about going away from a standardized test have even made comments about would it be worth it going back to an oral exam. But like you said, the problem with that is that was kind of done away with by a lot of states because of the subjectivity. And so it'd almost be like going backwards if that would be something that
Yeah.
would
Yeah.
I also wonder, and I just know a blip of the pieces of what it means to be an accredited MFT program. So I know, Chris, you can speak a lot more to this, but, and this is some of just my experience as a student too. I feel like that we underwent that to graduate, like meaning that because of everything that it took to be an accredited program, like all of the things related to being able to show competency in the skills that you're learning, is some of that happening within the programs that people are a part of that are accredited. And maybe that's me making too big of a leap, but I think that some of that happens as a result of being supervised and overseen within those programs as well to be able to graduate from them.
I think, though, I guess what you were talking about, David, that feels very different to me of somebody who's like, I've been practicing for 6 years or 10 years compared to I just got out of grad school and am immersed in this stuff. And I don't know, it feels like another kind of like public safety gatekeeping if we were to get rid of, if we took it away right out of grad school. But I don't know if you can say these people can skip the test and these people can't. I don't really know.
Yeah, I mean, I feel like it's been I feel like it's been somewhat successful in Kansas for us to have the 2 levels of permanent licensure. And I've talked to a few people in some other states where they talk about individuals not being able to reach the clinical pass point, the independent pass point. And some of the people in those states, they basically say, we feel sorry for the people, but if they can't pass the test in a few attempts, they're going to have to go and find another profession to do. And I've even made the point at the national, meetings for the Regulatory Board Association, and I said, if we're really trying to solve this issue as a country, we should be sharing information that, if these states don't have 2 levels of permanent licensure, but states like Kansas and Ohio do, and those people could be coming to our state to practice, we should be probably sharing that information. The problem is, I think, is every state is trying to figure it out for themselves, and they don't want to lose people that could be part of their workforce. But if the alternative is you stop practicing entirely if you stay in that state, I wonder about the benefit there too. So I don't know how exactly to address that, but to share that and say, for our people, and that's part of the reason why we asked the question on the survey for the LMFTs, where we said, are you currently taking steps to reach a clinical level license? And if you're not, why? Because we wanted to understand that group, specifically the ones that were at that group for more than 2 years. If they were not pursuing a clinical level licensure, but they had made a decision that was something that they liked, or it was interesting for us to learn more about that group and their motivations. So, well, I will bring back more information to you all. I hope this helps kind of frame the discussion. Like I said, the chair of the board didn't say that the advisory committees needed to make a recommendation on this, but thought it would be a timely conversation to have. And so I'll bring back more information for you. But if you could be thinking about this, and if you want to do research on your own, or maybe ask your colleagues what their thoughts are on something like this, that's definitely something that could be helpful to bring back and have as a part of this continuing conversation.
Great, thank you. Okay, excuse me. Moving to the next item there, then will be our next meeting. And David has queued us up for some things that we'll talk about in this meeting, but the next date is October 10th at 10 a.m. And we will then hopefully have our new advisory committee members on, and we'll do the annual board training that's required, and then some of the other regulations that he wanted us to look at and review. David, what else would you like to say on that?
Yeah, and so my initial thought was to do the annual training after we have all the new members appointed. But one of the challenges for that annual training is it's about an hour in length, and usually when you have that training, you miss out on about an hour of the advisory committee meeting, whichever one you hold it at. And so there's a number of topics that we're working with right now with the review of the surveys and the other conversations. And so I really don't want to take away time from your meetings. So what I wanted to propose this year is, as opposed to doing the annual training at each one of the advisory committee meetings, I thought perhaps what I could do is send out 4 different times and then offer to advisory committee members and board members, if they could find one of those 4 times to sign up, then they could go ahead and use that time for the training. And then that way, it's a little bit more efficient on my time, because I'm used to doing the training 7 different times for 7 different groups. But if we did it that way, then it would be 4 times instead of 7. So I'm trying to get a little bit more efficient with that. But then also I realize that some people, may have a conflict and may not be able to attend a certain meeting. So I figured, since the content is the same, we could have individuals from advisory committee members sign up for whichever one of the 4 options works the best for them. And then that way we can verify that everybody gets the annual training. And so you can cover that. So that's what I'm going to be trying to do. It'll be probably sometime in the month of September after the new members have been appointed. But I wanted to give you a heads up. That's what we're going to try to do this year, as just sort of making it a little bit more efficient. So keep an eye out for those dates, and then just go ahead and sign up for one that is fits the best in your schedule. And then in terms of the regulations there on the agenda for the next meeting, so I did go ahead and include quite a few regulations. There's about 9 of them there. And part of the reason why these are on here, so there was a bill that passed about 3 years ago, and it basically said every 5 years, a different set of agencies is going to come up for review, and we will need to answer certain questions about all of our regulations concerning are these necessary for implementation of state law. And I've heard comments from members of the legislature over the last few years that basically there's a thought that our agencies being as diligent as they should be in terms of reviewing their regulations, looking for outdated language, making sure they match the statutes, clean up. And so we've tried to be intentional about bringing regulations to you with some regularity. So we brought the unprofessional conduct regulations to you all, the continuing education regulations, the documentation of continuing education, the educational requirements for licensure, the definition. And so there's a lot of these big ones that we brought to you already. What these ones are, more or less, is a bunch of, I don't want to call them odds and ends exactly, but they are shorter ones that really are meant to accompany statutes and provide a little bit more context and detail. And so these are ones that some of them have not been updated in a while. Some of them have, but I would like to be able to say that over the course of the last few years, we have brought all regulations before the advisory committees, so you could put eyes on them. And then if you wanted to make recommended changes, you could. And if you decided there are no recommended changes that are needed, you could weigh in on that too. But this is to make sure that if that committee were to ask me, are we being diligent about this? I can say we have 50 to 60 volunteers that serve on advisory committees, and we have brought all of our regulations before them in the last few years, and they've had the opportunity to provide input, and as had the board. And so that's why I wanted to give you a couple of months notice. Some of these are real short. They're just about a paragraph. Some of these are a little bit longer, but most of these I think will go pretty quick. And I will work with our staff, and we will bring in suggested edits to these. But go ahead in between now and then and take a look at them and just see if anything stands out to you. Part of it will be matching things up to make sure that if there are numbers, the numbers are matching what was in the statutes, if those got passed in bill form in the last few years. Part of it will also be looking, did we change a process at one point and there's a reference in the regulation to something that is no longer the case? We want to make sure that we remove that. And potentially there could be a regulation. If we discover one that is no longer necessary, we could even say this was helpful for a time. We don't need it anymore. We could revoke this language now. So, but this process probably will go pretty quickly at the actual meeting. I just wanted to frame it why you have so many of them on the agenda, because if it was a bigger one, we would want to spread these out. So. Any questions about that or about the process? Some of these, by the way, are fairly uniform between the professions. So unless there's something glaring, we probably won't want to make, small edits unless, I mean, keep those in mind and bring those. But, there's a couple of them that I think apply to all the professions, like the reference to the DSM-5 or, how to look at individuals if they're receiving services from somebody outside of the state, that kind of thing. So those ones, you're going to find those for most professions. So a lot of these are standard ones you'll see, but if you have questions or something seems out of place or odd, bring those questions, because we do want to be able to answer those. And if you're having those questions, members of the legislature may have that as well. So this would be a good opportunity for us to clean up our language too.
Okay, that sounds great. Thank you for explaining and getting us all ready for that work. I appreciate that. Is there anything else for the meeting today that we need to consider?
David, can I clarify? We need to sign up for a 1 hour annual training. Is that what you said?
Yes.
Okay.
Yeah, and I will send out, I will look at the calendar and I will send out four date and time options. And I will try to spread those around. I've heard that some people may have a little more flexibility in the evenings. So one of our advisory committees, the psychology one, usually has a meeting from 6 to 8. So I'll put at least one option in the evenings for anybody who wants to do an evening one. Otherwise, I'll look to kind of see what are some of the traditional times for advisory committee meetings, or maybe even put one over a lunch hour. And so I'll try to use different times that I think people might be available. And then if you just sign up for one of those, it could be any of the four, and that would be fine.
Okay, thank you.
Yep.
Okay, anything else? All right, well, I appreciate everyone's input and work today. I think we'll be able to get out of here just a couple of minutes early. So I'll take a motion to adjourn.
So move.
Thank you. Is there a second?
Second.
All right. Thank you. All those in favor? Aye.
Aye.
All right. Thank you all so much. Have a great rest of your summer, and I'll see you in a couple months.
Thanks.
See you later.
Thanks, everyone.